Welcome back to the second episode of Kids-e Rotary Files Q&A series. Our next question is, hand file has to be used till what file size number before using Kids-e Rotary Files? So, a proper manual glide path is crucial for the use of any rotary file. I recommend preparing the canals manually till file size 50 to 20 depending on canal's natural width. This will help in the smoother progress of the rotary file and which will prevent the file fatigue. A clinical tip over here is, after the canal preparation is done with rotary file, every time we should use edge file in a pull-on motion with a copious amount of irrigation. This will help in opening all the lateral and accessory canals, and this will aid in achieving near ideal orthotic obturation. Our next question is, can rotary files be used in the cases of root resorption? Now this is a tricky question and I'm going to answer this question in three different scenarios. Scenario 1, physiologic root resorption. In such cases, yes, we can use the rotary file systems as most of the rotary file systems are designed for this purpose with non-cutting apical teeth. A care must be taken when taking a working length. It should be made 1 to 2 short of the apex so as to prevent instrument extrusion beyond the apex. Scenario 2, pathologic root resorption. In such cases, if the pathologic root resorption is limited to apical 1 to 2 mm, we can use the rotary files, but with caution. We should not push the rotary file apically. Minimum torque should be used, that is 1.2 to 1.5 only. And 24% rotary file, that is most commonly used for narrow files, that file should be used. Third scenario is severe pathologic root resorption. In such cases, it is better to avoid using rotary files, as most commonly in such cases, canal continuity will be lost, resorption will be more than 2 to 4 mm, dentate thickness will be lesser. So in such cases, it is better to avoid using rotary files. A clinical tip over here is, always take pre-op radiograph before starting your pod therapy. Our last question of this episode is, what is the irrigation protocol to be followed? After access opening, soda perchlorate should be used as the first irrigant as it provides good antibacterial property along with excellent tissue dissolution. During instrumentation, 2.5% soda perchlorate should be used with the saline alternatively in between the files. After the instrumentation, 17% liquid EDTA should be used as it removes smear layer and enhances the disinfection. And final rinse should be carried out with the saline as it's a neutral solution. A clinical tip over here is, always use sand-wetted needle during the irrigation. Thank you for watching.